So for this case study, I titled the facility Journey to Wellness Center. This is a day program that is a community-based setting. So it's similar to a Parks and Rec or something like that. For this facility, we serve people with emotional disabilities and physical disabilities. Emotional disabilities such as OCD, obsessive compulsive disorder, PTSD, which is post-traumatic stress disorder, depression, anxiety, and then physical disabilities such as vision loss or blindness. And we also treat TBI patients or traumatic brain injury and spinal cord injury patients. For this particular client that I worked with, she's 26 years old and she's a female, and she suffers with OCD, and her specific type of OCD is the fear of germs. So for the first goal, it is to increase leisure activity. After a 45-minute rec therapy session, the client will fill out a self-report form marking which 3 of 10 leisure activities she would be interested in doing. So by the next rec therapy meeting, she is to choose one leisure activity to do for at least once a week for 6 weeks. So there'll be 6 sessions. The second goal is to reduce the amount of hand washing per day. So as I said, my client suffers with the fear of germs, that type of OCD. So one idea is she could wear a rubber band and pull it every time she thinks about washing her hands. She could do this for a week to see if it helps. The next objective is exposure reaction therapy. She does not like to touch doorknobs, tables, chairs, or anything else that a lot of other people have touched without it being clean first. So for this, the therapist will get the client to hold the doorknob for 2 minutes, and they'll discuss how it made the client feel, and then the therapist will encourage them to not wash their hands for the rest of the day unless they really need to, such as if they go to the restroom or come in contact with blood or something gross. For the third goal, she did choose yoga for the leisure activity. So for the third goal, it's to demonstrate knowledge of yoga poses. The client will learn the correct technique of one yoga pose per week from the instructor for 6 weeks. So 6 yoga poses in total. The client will do a one-on-one demonstration with the instructor, showing them all 6 of the yoga poses at the end of the 6 weeks or sessions. These poses are basic but I feel like they do get a little bit harder. So we start out with the easy pose and do cat and cow pose and the child's pose, tree pose, and a couple others that just help with relieving stress and calming their mind, the client's mind, and their racing thoughts. So these 6 sessions met the client's needs by giving her, teaching her coping skills, so she don't have to just keep all the anxiety built up inside. It increased her leisure activity. Beforehand, she wasn't really doing anything that was actual leisure, other than just scrolling on her phone on TikTok or whatever, which isn't really a leisure lifestyle. But now she's going to a yoga group and socializing and getting outside of her head. It also lowered her obsessive and compulsive thoughts. So she still had those thoughts, but whenever she had those thoughts, she would do some yoga and practice her yoga poses. And these sessions gave her something else to focus on and care for. She, as I mentioned in the paper, she was also interested in basketball, art, and gardening. So those all give her distraction for when she has those repetitive thoughts, she can distract herself and go do something else. And the art and gardening and yoga even are all simple things that she could do at her own house. So she don't necessarily have to go out to a facility, but it helps with socialization, and the socialization helps with getting out of her head with her racing thoughts. So it just overall helped her